In this segment, we're going to do a counterstrain treatment to somatic dysfunction of the lumbar region, which are exhibiting posterior tender points. Now, the tender points in the lumbar region are located at the infralateral portion of the spinous process of the affected dysfunctional segment or over its transverse process. So you can choose whichever tender point's the worst if it's associated with that particular dysfunction. So they all come down to these either just paraspinal off the spinous process or a little more paraspinal, about a finger's breadth over, transverse. So let's pick one here. We'll say we have something here, a dysfunction around L2. So if we pick this tender point and say it's over the transverse process, what I'm going to be trying to do is position the patient's lower extremity, hip, pelvis, and influence the lower segments up to that dysfunction. So as we lift the leg up and side bend with the leg, adduct, abduct, etc., to get side bending, we're going to be moving these lower segments underneath this finger. And depending on how we need to rotate it, if this is rotated to the right, to this right side, I need to get the patient's L3, 4, 5 underneath it to rotate to the left to get this to be relatively right rotated. So we're dealing with this osteopathic theory of relativity when we work from the bottom up. So I'm going to take the patient's leg just below the patella at the tibial tuberosity, and I'm going to slowly lift up and see if I can, by extending this lumbar spine, if I can engage that particular segment. And depending on how much I lift up, I will actually incorporate that into my movement, or I'll back off just a little bit. So this will help with flexion, extension, or neutral components, so you can sort of feel how that softens up or gets prominent. And I need this to feel relatively rotated right in this case, if that's the dysfunction. In terms of side bending, if it's a type 1, I might actually bring the leg over to side bend it to the left. If it's a type 2, I might actually have to move it over here. But we're going to give you a classic type 1, which is what Dr. Jones particularly described, I think. So we're going to lift that up, pull that leg across the midline until I feel the side bending just occur to that spot. Make sure I have my flexion extension appropriate for that level. I'm going to